Welcome to the Mental Health Today show. My name is John Cordray, and I am a licensed therapist, and I've been a host of this show for, wow, a long time, 2015. If you have been with this show, thank you so much. If you're new, welcome to the show. I have a very special guest today. His name is Dr. Will Dobud. He's a social worker, he's a researcher, he's got a PhD, he's an educator, but most importantly, he has done a lot of work with adolescent mental health both in the United States, Australia, and Norway. He's been all over the place. Will is actually from Washington, D.C., but he divides his time between the United States and Australia each year. So I'm really looking forward to learning more about Will and about his research on teen mental health. I'm really intrigued on that. And he has a book that's coming out as well. And I want to talk more about that too. Will, welcome to the show.
Thank you for having me, John. It's great to be here.
Yeah. Well, it's good to have you here. And when I saw that you do a lot of research on adolescent mental health and helping families and parents, it really intrigued me. And then I saw that you go back and forth from the United States to Australia and even Norway. And I'm really intrigued because I want to hear about your research and what is it that you maybe discover between the teen and adolescent mental health between the countries? But before we get to that, I want us to get to know Will a little bit. Tell me a little bit about yourself.
Sure. I think that the opportunity to travel from different countries is unbelievable. And as a social worker, I mean, I grew up as a social worker in the US. I worked at intensive outpatient programs, residential programs. I would work anywhere that anybody would take me. From the time I was about 20 years old, I thought, this is just what I'll do the rest of my life. And I met my wife, Renee. She's Australian. I got dragged to Australia, worked at a large nonprofit here, and went, oh, this is a different way to look at it. Met a group of researcher psychologists in Norway and went, well, if they'll let me go to Norway and do some work and some research, I'll go there. So that's sort of been my life, is actually sort of thinking about psychotherapy, of which I am a massive nerd about. But psychotherapy from a cultural perspective has been my passion, which is we think about therapy as this sort of medicalized intervention. And I go, but culture informs it all the time. So being able to see it from different perspectives has been just a gift for me. So if I can share a story about one of my experiences in Norway, I went to Norway as a researcher in 2000, let's say 17, and we did a week-long wilderness therapy-esque, not wilderness therapy in the way that sounds in the American context. These were all young people that wanted to be there. And we went on this expedition, and one day the leader of this trip said, who here would like to go on a day walk today, and who here would like to stay at camp? And all I thought is, what teenager would want to go on a hike voluntarily? And it was a mixed gendered group, and only the women in the group said, yeah, we'd like to go walking. And I saw snow at the top of this mountain. I'd been in Australia a while, which meant I had not seen snow in a while. And I said, I'll go walking too. And we started scaling this mountain with another female social worker. We start climbing this mountain, 3 young adolescent women and myself and a social worker. And we get to the snow and we just keep climbing this mountain. And one participant said, I'd really like to go back to camp now. And I said, no problem. I'll take you back to camp. That's no issue. And the other participants kept on walking. And I just saw this like 1 second of ambivalence in this young person. And I said, do you really want to go back to camp? And she said, well, no, but I'm slower. I'm out of shape. I can't keep up with the rest of the group. And I said, well, screw that. And it was a gift because I was there as a researcher. I was not there as the clinician. I wasn't the therapist. I was like, well, we can keep hiking all you want. Like, let's keep going. And so we started walking slowly, and we started snoozing my phone and 10-minute intervals. I go, should we turn back now? We'll do 10 minutes more. Should we turn back now? We'll do 10 minutes more. And we turned around after about 2 hours of scaling this mountain, and there was a rainbow underneath us over this valley. And she said, "We'll take my phone, take a picture of me." And then she started playing religious hymns on her phone. And she said, "This is my church." And I sat there, and we sat down next to each other, and I thought, everything I know about psychotherapy and therapy is now broken. Here I am alone in a country where I don't speak the native language. She's using her phone to consolidate the gains of this experience. I have no first aid kit. I have no satellite phone. I have no map or compass. The only way I know where camp is because I can see it at the bottom of the mountain. And everything about it rocked my world. I went, oh my gosh. If I was here as Will, the therapist, I would have never allowed this experience to happen. And so there's something about getting out of our professional training. And I don't mean that in a creepy way, but like getting out and opening up the counseling room door, that it's been such a gift to see the world from a bit more of an international perspective.
Well, that's an amazing story. Thank you for sharing that. And, a lot of ways, no matter what country they're from, teenagers are very much the same. They have different cultures, different upbringings, but they're still teenagers, and we can learn a lot from them. And I remember years ago, I worked in a school district, and I worked with kids from elementary or preschool all the way up to grade. And, just not having an office where they came to, but I went to them and I was involved in their environment. That really, I think, helped open up a lot of conversations with these teenagers. And really, I think I liked how you identified that, yeah, this is what the teenager said, but you looked at her body language and you thought, well, maybe I need to ask a follow-up question. She said, I want to go back to camp, but you noticed that, well, maybe she doesn't. And she's just saying that. Maybe there's something else underneath that. And you brought that out. And I think that's great. And so when we're talking about working with teenagers and their mental health, I think understanding their environment and understanding their need for connection is key. And so I really appreciated that. What are some, speaking of different countries, you were not in the US at that time during that story. What, of all the years you've been going back and forth, are there similar but also different things with teenagers that you've noticed with mental health?
Well, I think that teenagers are inherently teenagers, which means that they are frustrating. They can call BS faster than everybody else. And inherently, I would say it's less than 1% of teenagers that Google you or me and say, hey, mom and dad, I'd really like to go talk to this person. So one of the things in the therapy context is that we have a massive engagement problem with young people. And so we think, I mean, and just look at the data that hits the headlines. Kids don't have sex anymore. They don't drink alcohol anymore. I mean, they're vaping, but they're not smoking. They don't go out. They're not playing outside anymore. They're not. And I'm just going, well, what have we all as adults engaged them in? What world have we shown them to go participate in? And I think there, in the therapy context, the second you start engaging with young people, that's when we as the clinician learn. That's when we start going, who am I talking to? Where adults tend to be, I mean, I read this stuff in my research work, teenagers are the hardest to engage in therapy. And then nowadays, teenagers are only on their phone. And I go, well, they're teenagers. Like, do we all remember what it was like Like it was awful, And then being told you have to go talk to a stranger in their office with diplomas and diagrams of the brain and books books you don't care about. I think that there is something that we have missed in some ways, something about what it's like to be a teenager and then what it's like to be a teenager in the clinician's office. And so I don't think there's anything, I agree with you. I don't think there's anything really culturally all that different. But we also need to, the reason I bring up culture is we also have to meet people through the worldview that they come from. No different than we would through religion, through lived experience. And so, but for some reason, when it comes to teenagers, I think sometimes we miss that part. And so I don't think teenagers are all that hard to work with when we look at it from an engagement lens.
I think that's an excellent observation. And teenagers, at the heart of who they are, they just want to be understood and listened to. And I think as clinicians, as we talk with teenagers about mental health, we need to remember that and to try not to bring a lot of clinical language to them and make it confusing, but just bring it down to earth and bring it more where they can relate to it and understand.
This is something I've grown really passionate about, especially over the last 6 to 10 years, where rightly so, social justice perspectives have become the forefront of headlines. So we talk about, does psychotherapy work for this population or that population? People from this cultural context, people from this type of identity. But the second you add age to it, it doesn't get talked about, which is, what do we do with, like, for instance, I work at a university in Australia, and we have a large a group of really amazing academics that are thinking about aged care facilities, older populations. How do we protect their dignity, human rights, these sort of things? And then when it gets to children, they're also off, not being discussed. And so we found things, like, not to front load the new book, but like we found things like the younger a child is in the classroom, the more likely they are to be diagnosed with ADHD and subsequently medicated. That can't be a coincidence that we're going, that kid doesn't fit in here, let's medically intervene. It doesn't add up to, I don't know, I can't square that. And so I think a lot of times with kids, we're taking these, from the psychotherapy perspective, we're taking these therapies that are created for adults and then just going, we'll just do this to kids now. And that part is, how do you actually tailor this to young people? And I think the answer is actually far more simple than changing the therapies. I think we have to actually think about what are kids going through, and sitting and probably ruminating about problems is probably not the right approach to this.
I think you're absolutely right. And I'm glad that you brought up the book. I want to talk a little bit about that, because you wrote this book. It's called Kids These Days. I love that. Understanding and Supporting Youth Mental Health. And so you've done a lot of research. We're talking about that research now. What are some key takeaways from that book, and why did you write the book in the first place?
Well, I wrote the book with my colleague Nevin Harper, who is an academic in Canada, and we were actually, oddly enough, sitting at a conference in Norway 3-4 years ago, right after the pandemic, when we were allowed to travel. And we were looking at all of our friends at this outdoor therapy conference. And we kind of just started thinking, so we get this narrative that there's an access problem to psychotherapy, to mental health interventions. But we've given so many people antidepressants that it's in water runoff, it's in the fish that we eat. There's more psychotherapists than ever before. There's more social workers, psychologists, counselors. There's more doctors. There's more experts. All you have to do is go to the airport to see that there's more parenting books than ever before. And somehow everything just we keep getting told everything's getting worse. And Nevin said to me, we should look at this and write a book. And I had finished an academic book right about that time. And I said, absolutely not. I'm done with, I'm taking a break. And what Nevin did is he just started interviewing experts. So he interviewed, like, for instance, Dr. Gordon Neufeld. Dr. Neufeld wrote a book called Hold On to Your Kids, which is a book with Dr. Gabor Mate that he wrote. And when I watched the Zoom recording that Nevin did, I went, this is like all these people at the end of their career going, here's what we really think is going on. And that really excited me. And we kept this mantra of, there's so many books about youth mental health. I mean, if you look at, Australia, October right now. We're a month and a half away from a social media ban for children. In the United States, it's only been social media caused a mental health epidemic, and it's it's been nonstop with this narrative. It's always focused on one thing, and kids are kind of like the canary in the coal mine. So if they really are more anxious, it's mostly about something that we did. What world did we create for them? And so we started just talking to random experts in random areas. And what we found was there's one way to look at youth mental health, and then there's another way to look at youth mental health. And so looking at it sort of full circle told a really different story than what the headlines were telling us. We hear this all the time. The kids are fragile. They're more disrespectful than ever. They don't play outside. But the truth is, we haven't given them something all that great to imitate. I grew up a very outdoorsy childhood. My dad told me I had to play outside more. And I was thinking when I read these headlines about my own adolescent children going, if I told you to play outside, would you know where to go? Like, I don't know if I've really set this up all that well. So we started writing it, and my passion is psychotherapy research, how to make psychotherapy meaningful for young people. So that's sort of where the book came about. The title Kids These Days that was sort of a working title at the start. But what I did was I went back and looked at how far could I go back to how long people have poo-pooed on children. You can get to Socrates. Now, that is 2,400 years ago. That they said kids are disrespectful, lack respect for authority. You look at Outward Bound. Outward Bound was created because of the declines of modern youth for things like advanced locomotion. That was the 1930s. Like the fastest car went 45 miles an hour. There was also Kurt Hahn, one of the co-founders of Outward Bound, also said there's an issue of kids taking too many stimulants and tranquilizers. Today, that's evidence-based practice. Like there's something really circular and repetitive about this. In the 1940s in New York City, they banned pinball because it was making everybody a gambling addict. And by the way, that ban took 30 years to reverse. They said Milwaukee had laws, no pinball during school hours. Think about what this means about today. So there's this notion of like being scared of kids, being nervous of teenagers. And yes, I do think teenagers are struggling today. I also think adults are struggling today. And so it's simple. It's easy to find a simple thing to scapegoat, that it's the phones. And as someone who is trained in solution-focused therapy, I think let's ask the miracle question here. Hypothetically, we all wake up tomorrow and there's no more social media. How are we going to be the adults in kids' lives? What are we going to do? Every person I ask this to says, well, we'll have relationship, we'll play together, we'll do things together. Okay, just do that now. Don't wait for the phones, don't wait for the government to sort this out. Let's do this now. And so that was sort of the genesis of the book. But our mantra was youth mental health from 40,000 feet. Let's not pick one thing. Let's look at all of it and see what, I mean, of course we missed things. I'm sure we didn't talk about nutrition or sleep, like all these other important things. But let's zoom out here for a second and look at the world we've constructed for young people.
Well, I think that's fantastic that you put all this research into that book. Who is the book for? Who is it designed for? Is it for parents? Is it for clinicians? All of the above?
Yeah, we tried. I would say we wrote that this is a book about youth mental health for adults. So we didn't just focus on parents. There's too many parenting books. And we knew we talk about this in the introduction, that there's some research that shows, especially with new mothers, rightly so. And we've all, for those that have raised an infant, it's terrifying. So you have this little thing that is so precious, and you read every book about how to make it sleep, and then it doesn't sleep, and you feel like a loser, right? So too much instruction can actually sometimes make us get really demoralized about what's going on. So we didn't want to tell people what to do. We wanted to say, here's the research, here's some of the things we found, here's what these experts said. At the same time, your kid, but like I haven't met your kid. I don't know. Like, this is, you make the best decision. If you're reading this book, you really care about children, or you care about, getting into it about a certain controversial topic or something. So that's great. Then make your decision about what to do. So we tried to do it in a way, I guess, in another perspective. Like, we interviewed a environmental health researcher, Dr. Bruce Lanphier, who I would say to everybody, Bruce Lanphier's Substack is one of the best things to read and totally terrifying. He's researched environmental toxins for a long time. He's fantastic. At the same time, none of us will be able to navigate environmental toxins, from pesticides, herbicides, lead, all these things. There's little we can do. So that doesn't mean don't go out to dinner with your family. Don't overdo this. There's little things you can do to navigate a complicated world, and do your best to mitigate the harms that we can do. So we didn't want to tell people what to do, because that list would be exhaustive. And when it doesn't work, it doesn't mean that there's not something else that you could try.
Well, I think that is a really good perspective. And it sounds like this is a tremendous resource that not just parents, but anybody working with adolescents, could be a teacher, perhaps, but anyone
Absolutely.
that's wanting to learn more about the youth culture. Okay, so someone's listening to this and they're interested in the book. Where can they go to find your book?
Well, we're pointing everyone towards Amazon, which I know is also a contentious topic of the day, but Amazon is the juggernaut. So that's probably the easiest place to get it. If you're more into independent bookstores, you can get it at any store. You could get it from Walmart or any of these, Target, or bookshop.org is a good, then you can give some money to a charity at the same time if you'd like. So, and anywhere you get books, you can get it.
All right, so it's very widely accessible if somebody is interested in that. So the title again for the book is Kids These Days, Understanding and Supporting Youth Mental Health. And I will put that information, a link on the show notes. So if somebody is listening, maybe they're driving, they don't have access to write it down, they can go to the show notes and look at the link and find your book that way. Well, Will, it's been just a tremendous opportunity to talk with you. I know we haven't even touched on a lot of the other things that you do. You do a lot of speaking as well, and you talk about America's troubled teen industry. You talk about wilderness therapy. You've talked to advocates and survivors and researchers, clinicians, all to protect them from institution and harm. We haven't even scratched the surface on that yet. So somebody can go to your I'm assuming your website and that the site can learn more about you, maybe ask you to speak, or maybe some other things that you have done. They can look and see what your research has been on.
Yeah, I'm a very open book. So anyone who wants to reach out and connect, feel free to do so. I'm a very big, I grew up playing music in Washington, D.C. And so I thought every time I met a musician and went, I'm going to go talk to that person and get to know them. So I try to pay that forward. Anyone who wants to reach out, I'm always open to connecting with anybody.
Fantastic. I appreciate your openness. I'm going to ask you to leave a parting word, if you will, to those who are listening to this about teen mental health. What would be your last parting words to us?
Sure. So we brought up the foundation of Outward Bound, and as an outdoor person, that those ideas were foundational to working with young people. Not that I'm saying the outdoors is better or worse than anything else, but one of Kurt Hahn's adages that we talked about throughout the book was to treat youth as crew and not passengers. So when we see things in the news like we have to ban social media, it still is treating young people as a passenger. It's we better do this passive intervention so that then they'll behave as crew. But if we give them stuff to participate in, they will participate as crew. We have to give young people meaningful things to do. And so I think young people are, and I guess from the American perspective, when I hear things about threats to democracy or we're so divided, we're more divided than ever, I think look towards children. Have we given them places and spaces where they can connect with each other, come together, have differing opinions? And so I think we like if we look at the rising rates of medication, what a passive intervention. I'm not pro anti-medication, but it's like, okay, so we've medicated them, and then what? Okay, we've removed the phones, then what? Like, so I think if we treat young people a bit more like crew, that they're needed for this mission, they're the future of the democracy. There's a great poem, and I forget the author of it, but it's youth don't belong to you, they belong to tomorrow. So if we keep setting up tomorrow, instead of playing along with this myth that there's something in their brain that's not working, that's dysfunctional, if we give them something to participate in, it'll usually work out, and then they'll be better engaged in whatever therapeutic service we're providing anyway.
I love that. That is a great reminder. Well, thank you so much for reminding us about connecting with youth and the importance of that. And I appreciate you coming on and sharing your expertise and sharing about your book that you wrote to my audience. I think that's fantastic. And I want to thank all of you who are listening to this. And I want to let you know I appreciate you. If you've been with me for a long time, thank you so much. And no matter where you're tuning in from, if it's the US or Norway or Australia or some other place, thank you for watching and take care of that teenager in your life. All right, friends, I'll let you go. And until next time, take care of yourself. Bye bye.